see my fine doctor. I'll call on my colleague doctors to, read our beautiful doctor's bio. So we know that we are serious here.
Okay. Good evening, ma. It's nice having you here. So I'll be reading our speaker's bio. Dr. Olatunji Yetunde Ramot was born in the early 90s to the family of Otumba Olakunjo Olatunji. Her compassion for others led her to pursue a career in medicine, studying at Olabisi Onabanjo University, Akwa Ibom, Ogun State. After completing her medical housemanship at Federal Medical Center, Abeokuta, she worked as a senior medical officer at the State Hospital, Ogun State. She is set to begin her residency program in general practice with a focus in internal medicine in August 2024. Dr. Yetunde's dedication to caring for others extends beyond her professional work. She volunteers with the Red Cross Society of Nigeria and serves as the medical director of the Ogun State chapter. During a National Youth Service Corps NYSC program in Enugu in 2020, she was appointed Chief Medical Director. Dr. Yetunde is happily married and committed to making a positive impact in our community. So this is our bio of our speaker. Such a nice bio.
Thank you very much, Dr. Yetunde, for honoring this invitation, and thank you very much for coming to explain endometriosis. Funny enough, when um I was in school, I was having pain in my left, is it left side or right side? The one that was the right side, yes. So I Google searched it and I saw endometriosis, and I was kind of scared that maybe I was having that because they were saying pain at the lower abdomen for coming to coming to show more light, feeling then or not. Okay, so the first question for today is, what is endometriosis? Before you even talk about signs and symptoms, we first of all need to know what endometriosis is. So over to you, Dr. Yetunde. What is endometriosis?
All right. Good afternoon. It's live chat. So just like you have mentioned, endometriosis they call women mostly. It's most common in young women. The disease which the tissue of the womb itself develops inside the uterus. The tissue is supposed to be in the uterus, but when the tissue are found elsewhere, outside the uterus, close to the fallopian tube, just like you have showed in your diagram, that's what causes endometriosis, and that's basically what it is. And it's a kind of disease that causes severe pain in the pelvis, that's your lower abdomen, and it sometimes can also affect fertility. But at least the main symptoms that we have for this endometriosis is the pain that it presents with, because it's a tissue that is found where it is not supposed to be found. And from your diagram, we can see that it can be found in the ovary, the fallopian tubes, the outside lining of the uterus, and sometimes it might even leave the pelvic region to go outside of the area. But although that is rare. Hello? Hello.
I hear you, ma.
We can hear you.
Yeah, we
We can
can
hear you.
hear
Ma. Thank
you,
you very
ma.
much, ma, for that wonderful.
Can you hear us, ma?
Yes, I think Tonke's network is a little.
Yes, my network is unstable. But can anyone to see my screen?
Yes,
Yeah,
we can see it.
Dr. Etunde, can you see my screen?
yes, I can see your screen.
Okay, thank you very much. So the next question is, what are the causes of endometriosis?
It has been said that there this is a, but the main the things that have been studied, and the studies have shown that there are some things that causes it, although they are not substantial enough to say this is the cause. And some of it is the fact that we call what we call a retrograde menstruation. That is when you the first time you menstruate, that is your menarche, that first period. When the blood that is supposed to come out through your vagina flows backwards through the fallopian tube into the pelvic area, and then it deposits its cells in those places. Those are one of the reasons, the things that can cause endometriosis. Then another thing is what we call a cell metaplasia. That is the cell just on its own develop in other places. No cause, no predisposing factor, nothing. It just happened. So it's actually, we can say there is no known or particular cause for this endometriosis, because these other are just things that happen, and in the view says it does not happen all the time.
Thank you very much, Dr. Yetunde, for that description. But I would like to ask, is there a, so that means from what age or
Um, like I said, the first way to say is when you have your first period, because
okay.
the symptoms are that your period. It is when you have your period, have pain. The cells are shed during our period. Whenever mostly during your period, so the time either your first period as well as later on, maybe at 2 or 3 years after the period.
Okay, thank you very much, ma'am,
Thank you,
for
ma.
that beautiful explanation. Moving on to the next one, what are the symptoms of endometriosis?
Okay, so the symptoms are actually is more mainly pain, and common they have
Okay.
pain in your that's the lower part of your, and it occurs most during the period.
Dr. Yetunde, please wait. I'm struggling to hear you, please.
Hold on for me.
I don't know if it's my network or your network. Okay.
Can you hear me now? The network better.
Yes, yes, I can hear you now. It's better.
Okay, so I said that the main symptoms that you can have is pain in the lower abdomen, and occurs mostly during your menstrual. Okay, please, you maybe you can mute. If you mute, then I think the echo is going to reduce.
Okay.
Sorry. Okay. I think it's fair this way. So during the period, then some people also have this pain after sex or after going to the toilet, either urinating or defecating, but it's not as when you're having the pain. Then some other people also experience low back pain. Then the other symptoms that you can have is heavy menstrual flow is also a part of endometriosis. Some people also have troubles getting pregnant. If you are married, you're not pregnant, you are having low back pain, your menstrual period is severe, then there's also bloating. You can feel bloated, there's nausea, there's fatigue, there's anxiety. All these are symptoms that you can have when you have endometriosis. However, like I said, the main symptom that people present with is this severe pain in their lower abdomen. Yeah.
Thank you very much, Ma, for that explanation and throwing more light on the symptoms of endometriosis. But before we move on to the next question, I would like to ask you, like, what's the prevalence of endometriosis in Nigeria, or maybe like in your line of work or in your place of work?
Okay. Well, from my studies that I did, there is roughly 10% of reproductive age women globally actually do have endometriosis. The reason why I don't really have enough data for my place of work or from Nigeria generally or gynecology study is because before people think that you have endometriosis, they would have gone through so many treatments, so many diagnoses. Some will not even come to the hospital. So the diagnosis of endometriosis is not something that you just pick up or somebody just pick it up. So it's in 1 in 10 out of ladies come to the hospital about having lower abdominal pain. 2 or 3 of them will have endometriosis. However, the problem that we have is diagnosing this particular condition because it is not a direct diagnosis. A lot of people come in with abdominal pain, severe menstrual pain, remembering that it is not only endometriosis that is causing severe menstrual pain. So, but from the study that I did, WHO states that 10% of reproductive age women globally do have endometriosis.
Thank you very much, Ma. I would like to ask, you said that in the symptoms, when you're talking about the symptoms, you said severe abdominal pain. So I'd like to ask, how frequent is that pain? Because sometimes you can even feel pain without exercise. So how frequent is this pain for us to actually know, okay, maybe something else is wrong, not just maybe, yeah, if it hurts too much or maybe internal pain or something. I'm sorry, you are muted. You are muted. Dr. Yesune, you are muted. I'm sorry, you are muted.
Oh, all right. So I said a lot of females do have lower abdominal pain. In fact, almost all females in their reproductive age will have pain in their lower abdomen. However, this particular pain comes in frequently. Like I said, if it is associated with your menstruation, it comes in every time you menstruate, every month, severely. Even after using your normal analgesics that you use, maybe, pre your period and everything, it still comes in throughout. And sometimes this pain even stays long after your period. Your period is 3 days, 4 days after you're still having this pain, the 5th day after you're still having the pain. And then it comes every month. Also, if it is associated with the sex. It causes pain during sex. You will not be able to withstand the pain during sex. So this particular pain are not just something that is a normal thing. It's not normal because you yourself, you know that this pain, I need to go to the hospital to check out what is going on with it. So if it is associated with the menstruation, it comes every month. In fact, more frequently than the last time you had your period. Then also the one that is painful sex also too. You would know that this is not a normal pain that you have.
Understand endometriosis, and then when you
Aderonke is muted. Shiba.
okay, yeah. Can you hear me now?
Yes, I can.
Yes,
Okay,
ma'am.
now Dr. Yetunde has helped us to actually explain the signs and symptoms of endometriosis. We live in a country whereby when women have stomach pain, they tend to endure it. Even when it's severe, they just go to the hospital, ask for medication. They don't really even do deep tests like that because I heard endometriosis testing actually is very expensive, right? And then, right? So some people don't actually go for it. So when you extreme excruciating, no. So moving on to which is at what we Dr. Etin have actually said this before, but it's part of the question. At what age does one typically develop endometriosis?
Okay, so, I'll repeat it again. When you start your period, like girls nowadays start their period at the age of 12, 13, even as early as 11. However, it is not to say because you don't have that pain when you are 12 or when you start your period, you cannot have it in the next 5 years. It can actually develop in the next 5 years. So at least from the first time you have a period till the last time, some till menopause, because this particular condition is associated with hormone called estrogen. And the point when you start having this estrogen that is causing this thing is from your when you start your menstruation to menopause. From menopause, your estrogen level comes down. And so this pain might be indetectable at that time or has gone. Yeah.
Thank you very much, ma'am. So moving on to the next question. What are the risk factors associated with endometriosis? Over to you, doctor.
Okay, so as I mentioned when I was saying the cause that the cause is not known, but there are some factors that contribute to its development. The first one I mentioned the other time was what we call the retrograde menstruation, which I explained that's when the blood containing these endometrial cells flows back into your pelvis through your fallopian tube. The other factors that we have is what we call the cellular metaplasia, when the cells from the endometrium itself just develop somewhere else or metaplases and goes to other sides of the pelvis, the ovaries, the fallopian tubes, and other parts of the pelvis. The other factors that we have is what we call presence of ectopic menstrual tissue. Those are the factors that we can say that are associated with endometriosis. The other factor that is more important is the estrogen level in a woman. The relationship between estrogen and endometriosis is actually complex. Because the absence of estrogen does not mean that you will not have endometriosis, but it is also a factor that increases the risk of endometriosis.
Thank you very much, Dr. Yetunde. I would like to ask you a question. So that means it's not hereditary, it's not
N-
genetic.
No.
Okay.
Okay, I can say, but the genetic part of uh, I can say is there because of what like cellular metabolism. You can your body can that genetic predisposition to having that cellular metaplasia, but it is not hereditary. No.
All right, ma. Thank you very much, ma. Moving on to the next question.
Which I think is the last question for the day. Yeah.
What advice or support would you offer to women who suspect they may have endometriosis or have been recently diagnosed, ma? To you, doctor.
Okay. You mentioned the fact that some women do have pain and they don't go to the hospital. They just feel like when you have a pain as a lady, you have the pain this month, you have the pain next month. The best thing for you to do is go to the hospital. See a gynecologist. Explain to them what you have. Some people don't want to go to the hospital. I don't know why people don't like going to the hospital to see a doctor. It's better for you to go. And although there are several screening tools for this endometriosis, and just like I've said, I also mentioned, in our country to diagnose it is quite expensive, but that does not mean that you will not see a gynecologist that will tell you that this is an endometriosis. You can do a scan, MRI, and detect endometriosis. And because I said this pain can go on for a long time in your life, it causes some mental what am I saying? It can cause some mental anxiety. You have this mental breakdown every month because of this pain. There is anxiety, it causes depression. So it's better when you go to the hospital, you're being diagnosed of the endometriosis. And there are some treatments that can actually be given to you. So you don't make this particular disease better. And there are pills, there are hormone medicines that you can be given. There's some analgesia that can be given to you to reduce the pain that you have. So it's something that you can actually manage very well. And people that are trying to get pregnant because of endometriosis, after some treatment, they do get pregnant, and it does not really stop them from their fertility medicines. There's some procedures that can be done for you if you have endometriosis. So it's not just, okay, endometriosis, there is no money for me to go to the hospital. Let me just sit at home. No. There's some other damages that this particular condition causes in your body. It can cause adhesions. It can cause a lot of other things that you don't know. But going to the hospital, letting them diagnose you, getting some drugs will actually make it better for you. And yeah, I think that's the advice that I have.
Okay, thank you very much, Dr. Yetunde. And when you're talking, you said endometriosis can be managed. So that means it's not curable. It does not have a cure. It can only be managed.
Yes, not curable, but
Okay.
I said, there are so many treatments that you can have. Application on, depending on the symptoms that you have. Pain, even let's say we are trying to conceive, so many procedures, and outside or even in this country, some also do some laparoscopic surgeries to remove some of this tissue and reduce the pain. But just like you have said, it's not curable, but there are ways we can manage it properly to a minimum level.
Trying more light on endometriosis. And we've come to the end of this. Okay, so we've come to the end of, if you be woman or get out there, it's not until this pain actually kills you before you speak out. When you start to feel pain, like Dr. Yetunde says, the first thing is try to go to the hospital to seek help. It's not normal. Funny enough, then in school, you see some girls who are having menstrual pain and then they can't do without going to the hospital. Like every month they are going to the hospital, because the pain is too much. And this could actually be the reason why they are having this much pain, but they wouldn't know because they're not even doing proper testing and all that. After the whole menstruation phase, and they are back to normal, they will stand up and continue life till the next menstrual cycle. Like, how long does someone want to continue with that kind of cycle? So please, women and girls out there, it's not only you. If you know someone else, you can actually like reach out to them and tell them to go for proper testing. Doctor, is there a specific name they call the test, or is the gynecologist that will tell you from signs and symptoms
Yes,
that this is what's wrong?
yes. It's not enough to just see a general doctor. You also need to see a gynecologist because the gynecologists know the difference between a normal menstrual pain and endometriosis pain. So then they direct you to do that. Not enough for you to just go and do an abdominal scan and then you just bring it that you need to do it a recognized place because anybody can do a scan, obviously. I can learn a scan in 3 months, but you need to do it in a place where it's well recognized. The radiologist that is in charge of this scan, then the gynecologist. So there are some other scans too, like I said, the MRI. There is also this procedure where they just use a camera to see inside of uterus and the pelvis. So those are things that they can actually do. But you need to see a gynecologist to know exactly which you you should do. Yes.
Okay. Okay, thank you very much, ma. Now I totally understand. Thank you very much, ma. I don't know, one last question before we call the pain in our lower abdomen, whereby the pain is actually not in our lower abdomen, but in that part of our body, right?
Yes.
So now, what other thing gives up the vibe of endometriosis, but it's not endometriosis? That means something else that shares signs and symptoms of endometriosis, like another disease that shares signs and symptoms of with endometriosis.
Okay, so uterine fibroid. Uterine fibroid actually cause some symptoms of
Okay.
endometriosis. Then, the normal menstrual because if you have a area, you have this lower also this uterine fibroid. But the good thing is if you have a uterine fibroid, you also bleed, you have heavy bleeding, you have this pain also. Then when you do a scan, where like just like everybody does, they will tell you that you have a fibroid. So that rules it out. You know this is a fibroid. However, um, you can have a uterine fibroid and still have endometriosis. So even after removing the fibroid, you still have the pain. You see, so you can see that then ovarian cysts too can cause this pain that you have, this lower abdominal pain, this one, the ovarian cyst pain actually comes more during your ovulation period. So you have the pain during those periods and even during your menstrual period too. It doesn't really count. So those are the things that can actually cause pain in the lower pelvis. Then PID, infection of the of PID. So those are the things that can actually mimic endometriosis.
Thank you very much, Ma.
And thank you very much for honoring
You're welcome.
to come and explain. Malaria, if it's not typhoid, if it's not malaria, people don't know any other thing, and they okay, maybe UTI. Those are the those are the common things that people to know about. That malaria, typhoid, UTI. That's like basically what Nigerians know. Except from that, they don't know any other thing. So thank you very much for throwing more light on endometriosis. So we've come to today's Belle by Choice live chat, and then just know that we are always here to answer to your sexual and reproductive health needs. If you have any question concerning your sexual and reproductive health, you can just reach out to us. If you feel pain anywhere, if you're seeing something that you're not supposed to see, you can just reach out to any of our phone numbers that are out here. So we've come to today's live chat. Thank you very much, Dr. Yetunde. We hope to see you and host you some other time. Have a nice and enjoy the rest of your evening. Thank you.
Thank you.
Thank you very much, Ma. Bye.
All right, bye-bye.